Welcome to your deep dive. Today, we're going deep on a condition you've probably never heard of. It's called non-thrombotic pulmonary embolism, or NTPE for short.
NTPE.
We're digging into a medical review article. It's actually called non-thrombotic pulmonary embolism to find out why it's such a medical mystery.
You know, most people, when they hear pulmonary embolism, they think blood clots.
Right.
But with NTPE, we're talking about a totally different situation.
It's kind of wild when you realize just how many unexpected things can actually get stuck in your lung arteries. We're talking fat cells, tumor cells, even air bubbles.
Yeah, it really is a fascinating area of medicine, but also a challenging one. With so many potential culprits, diagnosing and treating NTPE can be like, solving a medical puzzle.
So let's start with one of the culprits that really surprised me, fat embolism. The article mentions it can happen after almost any pelvic or long bone fracture.
Yeah.
I actually broke my leg a few years ago, and honestly, I'm a little worried.
I understand your concern, but let's break it down. While fat embolism itself is relatively common after fractures, the really serious stuff, fat embolism syndrome, or FES, is much rarer.
Right.
And the article points out that prompt fixation of the fracture, especially in the femur, can really make a difference.
So quicker surgery, less risk.
Exactly.
That makes sense. But what is actually happening in the body with FES?
Imagine this: when you break a long bone, fat globules from the bone marrow can actually escape into the bloodstream. In FES, those globules get lodged in the small blood vessels of the lungs, causing all sorts of problems.
Like what? The article mentioned breathing difficulties, but are there any other red flags?
One classic symptom of FES is a petechial rash, which are tiny red dots on the skin caused by bleeding from those blocked capillaries. Imagine it like this: those little dots are like a distress signal indicating something's not quite right in the blood vessels.
So prompt fracture repair is key to keeping those fat globules from, causing trouble in the first place. It's amazing how such a seemingly simple thing can make all the difference. But shifting gears here, another type of NTPE that really caught my eye, and honestly sent chills down my spine, is amniotic fluid embolism, or AFE. This one seems particularly frightening, especially for expectant mothers.
AFE is definitely a serious condition, although thankfully rare. The article mentions it occurs in about 1 in 40,000 deliveries in the U.S. To put that in perspective, that's far less common than a typical blood clot-related embolism. But what makes AFE so concerning is its potential for very serious complications.
The article mentioned a disturbingly high mortality rate. What exactly makes AFE so life-threatening?
It seems to be a perfect storm of events. During labor or shortly after delivery, amniotic fluid, which contains fetal cells and other debris, can enter the mother's bloodstream. Now, imagine that amniotic fluid causing a sudden and severe, confusion in the mother's immune system, like hitting an emergency shutdown button on her body. It can lead to a cascade of problems. A sudden drop in blood pressure, difficulty breathing, and in the worst-case scenario, even cardiac arrest.
Sounds terrifying, like a race against time to save both the mother and the baby.
You're right, it often is. Early recognition and immediate medical intervention are absolutely crucial. Treatment focuses on supporting the mother's vital signs while also ensuring the safe delivery of the baby, if that hasn't happened yet.
Moving from one medical mystery to another, let's talk about a condition that affects primarily cancer patients: tumor embolism. Reading about it really got me thinking it's like a double whammy for those already battling a serious illness.
It's a sad reality. Tumor embolism happens when cancer cells break away from a primary tumor, travel through the blood, and, you guessed it, get stuck in the lung arteries. This is unfortunately often a sign that the cancer is more advanced.
So we're talking about a potential complication on top of an already serious diagnosis.
Yeah.
That's heavy.
It is. And to add to the complexity, the symptoms of tumor embolism, such as shortness of breath and chest pain, can be very similar to other conditions. This can make early diagnosis difficult, especially if a patient's cancer history isn't immediately obvious or known.
It really highlights how important it is for doctors to be aware of all the possibilities, especially with a condition as multifaceted as NTTE. And speaking of unusual possibilities, some of these other causes of NTPE mentioned in the article are straight out of a medical mystery novel. Hydatid cysts, for instance. Those are caused by parasites, right?
They are, and while thankfully less common, they illustrate just how diverse the causes of NTPE can be. These cysts often form in the liver, and if they rupture, those parasitic larvae can make their way into the bloodstream and become lodged in the lungs, mimicking a pulmonary embolism.
It's amazing how something so small can wreak such havoc. But okay, get ready for this, because I couldn't believe this was in the article. Injecting things like crushed pills or even mercury can cause NTPE.
Yeah, it's a stark reminder of the health risks associated with intravenous drug use. You see, the human body has amazing mechanisms for filtering out foreign substances. But when you inject something that isn't meant to be there, especially something that doesn't dissolve easily, it can create blockages in those tiny capillaries in the lungs. It's like trying to squeeze a square peg into a round hole. Not a good scenario.
Definitely not. I also read about gas embolism, literally air bubbles in the bloodstream. I knew it was a risk during surgery, but the article mentioned scuba diving too.
Right, and it highlights how crucial it is to understand the effects of pressure on our bodies. If a scuba diver ascends too quickly, the nitrogen dissolved in their blood can form bubbles. You know how when you open a soda bottle too fast and it fizzes up? It's a similar concept. Those bubbles can then obstruct blood flow, leading to a gas embolism.
Wow, I never knew that. So even recreational diving can be risky.
It can be, yeah.
This really underscores the importance of understanding the risks involved and, following proper safety procedures.
Absolutely. Whether we're talking about complex medical procedures or recreational activities, knowledge and awareness are paramount when it comes to preventing potentially dangerous situations.
Speaking of knowledge and awareness, this deep dive has really highlighted how crucial accurate diagnosis is for NTKE. From what I gathered, it's not as simple as just doing one test, right?
You're absolutely right. It often involves a combination of clinical suspicion, imaging studies, and even laboratory tests. Think of it as detective work.
So walk us through it. Where do doctors even begin when they suspect NTPE?
It all starts with a thorough evaluation of the patient's symptoms, medical history, and any potential risk factors. Imagine a web of clues we're looking for any threads that might lead us to the root cause of the problem. Then we can use imaging techniques like CT scans and echocardiograms, which are like taking a peek inside the body to see if there are any visible blockages in the lung arteries.
It's amazing how far medical imaging has come. The article also mentioned analyzing blood or even lung fluid for specific cells. That sounds pretty high-tech.
It can be incredibly helpful. For example, if amniotic fluid embolism is suspected, we might examine a blood sample from the lung arteries for the presence of fetal cells, which would confirm the diagnosis.
It's like piecing together a puzzle using all these different tools to get the full picture.
Exactly. And that's what makes medicine both challenging and incredibly rewarding. It's about connecting the dots, recognizing patterns, and using all the information available to make accurate diagnoses and guide effective treatment.
This has been a real eye-opener. Who knew something as seemingly straightforward as a pulmonary embolism could be so complex? But before we wrap up, I have to ask, is there anything people can do to prevent these unusual pulmonary embolisms?
That's a great question, and it's important to remember that prevention strategies will vary depending on the specific type of NTPE we're talking about. However, there are some general principles that apply across the board.
Give us the preventative pearls of wisdom.
Well, as with many health conditions, maintaining a healthy lifestyle is crucial. That includes a balanced diet, regular exercise, and avoiding smoking. These simple steps can go a long way in preventing a whole host of problems, including those that might increase your risk of NTPE.
Makes sense. Anything else?
Be proactive. If you have a history of cancer, recent surgery, or any other condition that might make you more susceptible to NTPE, it's crucial to discuss it with your doctor. Early detection and management of underlying conditions are absolutely essential for prevention.
It's all about being informed and taking charge of your health. I have to say, this deep dive has definitely given me a lot to think about. It really is incredible when you think about it. We take breathing for granted, but there are so many things that can disrupt that delicate balance.
Right. It really speaks to the complexity of the human body and how interconnected all of our systems truly are.
I'm definitely walking away from this deep dive with a whole new appreciation for my lungs. And maybe a little paranoia about crushed pills. But hey, knowledge is power, right?
Absolutely. And remember, if you ever experience any unexplained breathing difficulties or chest pain, don't hesitate to seek medical attention right away. Early diagnosis and treatment can make a world of difference when it comes to NTPE.
Couldn't have said it better myself. So until next time, keep those brains engaged, stay curious, and maybe lay off the scuba diving for a bit, huh?
Sounds like a plan.
This has been your deep dive into the world of non-thrombotic pulmonary embolism. We'll catch you next time for another fascinating exploration of a topic you probably didn't know you were curious about.